One of Ontario's largest children's hospitals has had to do something extraordinary. The Children's Hospital of Eastern Ontario, or CHEO, turning to the Canadian Red Cross to ask for help. Now, CHEO has been working over capacity for weeks, and asking for help from the Disaster Relief Agency will help the hospital deal with unprecedented volumes. Ontario's Premier was asked about it today. Take a listen to Doug Ford.
I got to give Alex Munter a shout out, the CEO over there. He's done an incredible job thinking outside the box. He's brought pediatric experts from Orange in to help out. I want to thank the Red Cross for helping out on the administration side to free up our frontline healthcare workers.
So, is this a new normal? With his reaction to the situation at CHEO hospitals in Ontario and right across the country, we're now joined by Dr. Alika Lafontaine. He's president of the Canadian Medical Association. Dr. Lafontaine, thank you for being with us.
Thanks for having me.
So I do want to begin with your reaction here to the Canadian Red Cross being called in to help meet the need at CHEO right now. Is this acceptable? Is this what Canadian healthcare is meant to look like?
So I think the first thing to remember is that this has actually happened before, but with adults instead of children. You know, a couple of years ago, we had multiple things happen with an adult critical and in-hospital care that we just didn't expect. We shut down services. We asked for help from the military. You know, we did talk about using the Red Cross in different provinces when we were confronting different COVID waves that we were faced with over the past couple of years. So it's no surprise that this is now hitting our children in much the same way. I don't think that this needs to be the new normal, but this will be the new normal as long as we don't make foundational changes in the way that we provide healthcare.
Okay, you say foundational changes, and part of that seems to be money, if I'm correct here, because the Ford government, I don't know if you know this, they're being criticized in Ontario for underfunding hospitals right now. It has spent $859 million less than expected on healthcare so far this year. And I realize, as you say, this is extraordinary time. We have this triple threat of RSV, the flu, and COVID-19. But foundational aside, how much of this is about money and not enough of it being placed into the healthcare system?
So I think it's about both sides of the equation, not only how much we're spending, but also where the money is going. You know, we've had a couple of decades that have brought us to this point where we've cut services and tried to function with as little capacity as possible in order to meet the service demand. So now that we have these spikes, now that we have these waves of respiratory illness affecting our children across the country, it is expected that we're now running into these problems. And so, you know, it's not only how much we need to spend, but also where we spend it. And so we definitely need increased money, but we need to spend it differently as well.
Okay, talk to us about that, because, you know, I was going through the website of the CMA, and there's this talk about how the money, how it's allocated, how it's invested, does not actually meet how healthcare needs to be delivered now. So talk to us about these foundational changes that you would like to see, and how perhaps what we're dealing with is an outmoded way of thinking of healthcare.
Mm-hmm. So I think what we're really seeing as Canadians in real time at hospitals that are confronting this wave of pediatric respiratory illness is that we're getting a breaking down of silos. You know, groups are getting together and they're talking in ways that they didn't before. You know, team-based care is really being operationalized by their CEO right now. You know, you're having Orange talk to the hospitals. Hospitals are talking with community care. They're also talking with experts within the hospital to make sure that things are guided in a way that really deal with the problems that parents are coming with when they bring in their children. You know, the same sort of team-based care is something that the CMA has advocated for years to implement, but it needs to be funded. We need to get a shift in our model away from, you know, these solo isolated practices that we have. You know, bringing back virtual care in Ontario and elsewhere, making sure that it's a part of the continuum of care. Changing the way that people are licensed and privileged. That way we can go to places that need our help as fast as possible. You know, these are all part of the foundational changes that we're talking about that we really need to lean in right now in this crisis.
Okay, if you don't mind, could you paint a bit more of a detailed picture? What do you mean by team-based healthcare? Because, you know, in many parts of this country, people can't even get a primary care doctor.
Mm-hmm. So what happens right now is people are in silos. So when we talk team-based care, it's a patient going from team to team and being that link between them. I think what you're seeing evolve at CHEO and other places that are confronting these crises is a breaking down of those team walls. You know, having people speak behind the scenes more than just when an urgent case comes in that they need to confront in the moment. There are different ways that we can make the experience seamless for patients going through. We should not have to wait for, a family doctor to call into emergency trying to advocate for their patient. There's ways that we can share information. There's ways that we can meet day to day to make sure that we're rounding and utilizing resources appropriately. And, in the midst of these crises and spikes in need, bringing in things like EMS and air transport and communities in order to get a track and an idea of where people are actually having the problems is really, really important. So I think CHEO is a good example of how team-based care is being implemented in real time.
Mm-hmm. What role can Ottawa play? Because, we are talking about CHEO here, but as you know, hospitals right across the country are struggling right now to deal with this now new need of RSV, the flu, and COVID-19 after years of dealing with COVID-19. And I wonder about Ottawa's role, because sorry to harp on the dollars, but the provinces will argue that Ottawa covers less than 25% of healthcare costs in this country.
So once again, it's not just the amount that we spend, but also how we spend it. So how can we spend it differently? We've talked for a long time about a national healthcare system. In reality, we have 13 siloed jurisdictions across provinces and territories. We have a real opportunity right now to share data, that really would have helped with the respiratory crises that we're running into right now with our pediatric populations. We have the opportunity to share workforces. That's looking at registration of health professionals across the country, making sure that they're mobile, that they don't have to register again every time that they move across those jurisdictional lines, province to province, territory to territory. Making sure that we move towards that team-based care again, encouraging people through incentives and funding to practice together instead of by themselves. All of these things lead to what I think at the end of the day is making sure that we solve the problems of the patients that come through the doors of the places that they access care. And that's really what I think more and more Canadians are expecting from us, not just for pediatric patients who are in the midst of this crisis, but also moving forward into what comes next for healthcare.
Dr. Alika Lafontaine, thank you for this. Really appreciate the time today.
Thanks for having me.